Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Our current 5-day COVID-19 test positivity rate is 1.8%. 22 new cases of the virus have been identified today as of 9:30 a.m., bringing the total number of cases in Manitoba to 1,608. Today we are announcing a 17th and 18th death related to COVID-19. A man in his 80s from Southern Health and a female in her 80s from Prairie Mountain Health. So we want to extend our condolences to their families and loved ones. Today there is one case in the Prairie Mountain Health region, 2 cases or 3 cases in Southern Health, and 16 cases in the Winnipeg region. Today's data also shows we have 363 active cases. 1,227 individuals have recovered from COVID-19. We currently have 8 individuals in hospital, 2 of which are in intensive care, and the number of deaths related to COVID-19 is now at 18. There were 1,626 tests completed on Friday, 1,425 completed on Saturday, and 1,116 completed on Sunday, bringing our total to 166,998. Testing site locations may change in response to changes in testing volume, so Manitobans are reminded to refer to the list of current testing sites and their hours of operation on manitoba.ca/COVID-19. We have a number of exposures that we announced on the weekend that included Gordon Bell High School, Monroe Early Childhood Education Center Preschool, Garden City Collegiate, Cafe La Scala, the local public eatery, the 21 Lounge, and Meadows School in Brandon. Today we have additional possible exposures to list. That is Planet Fitness, 783 Leela Avenue, and that was from Tuesday, September 15th from 3 p.m. to 4 p.m. 7 Arabian Dreams, 775 Cordon Avenue in Winnipeg, and that's Friday, September 18th from 11 p.m. to 2 a.m. and Sunday, September 20th from 12:45 a.m. to 1 a.m. There's a Winnipeg Transit exposure, route number 14 on September 15th from Ellis Avenue and Spence Street at 11:10 a.m. to St. Mary Avenue at 11:30 a.m. We note that many of these new cases have had large number of contacts, and that means we're having additional people who are exposed to the virus, and contact tracing becomes more complex. So we're certainly continuing to watch test positivity rates as the number of cases increase, and watching a number of those indicators over time. We follow these evidence-based indicators which will inform us of when additional measures are going to be required. So we certainly don't ever have anything off the table, but we know what to do right now to limit the spread of this virus, and that is practicing those fundamentals. We're avoiding closed places, crowded places. Outdoors is certainly less risk than meeting indoors. And those fundamentals that we all know, staying home if we're ill, even mildly ill, washing our hands frequently, practicing physical distancing when outside of the household, and wearing a mask in indoor public places. And again, need to highlight the importance of staying home when you're ill, even if mildly ill. And that means staying home, avoiding contact with others. Don't go out to gatherings or meeting with friends, certainly not to school or to work. And we know that today's action affect our lives up to 2 weeks from now. Speaking to employers, again, working with the employees to ease the burden of staying home when ill, as opposed to coming to work when ill. And one last statement on stigma, that we need to deal with COVID with compassion and without judgment. And we know that stigma, there is the moral issue with that, which is definitely important. But also important is that when we stigmatize groups, we decrease the likelihood that they're going to be going for testing. So stigma plays a big role in our ability to manage this pandemic. When positive tests, positive cases are heavily scrutinized or treated in stigmatizing fashions, this will discourage people from going for tests, and it will definitely impair our ability to manage this pandemic. So it's very important to ensure we're not perpetuating stigma on any group. So thanks for that. I can open up for questions.
Dr. Roussin, I know there's been a lot of discussion about potential mask mandate for Winnipeg, reducing group sizes. What led you to not make that call today?
Yeah, we didn't make a call today is because we're still looking at a number of our indicators. If we look at the total cases in Winnipeg, active cases, 282, not much more we saw at the time we instituted that in Brandon with much smaller population size. We can see that we're not seeing a heavy burden on our healthcare system at this point, but we're watching these things very closely, and we do want to be able to respond when necessary. So didn't make that decision today, but like we said, nothing's off the table. We're still watching all those.
And how taxed out are your contact tracers now? I mean, how close are we to getting to them not being able to keep up with their caseloads, given how you've described the large number of contacts in some of these cases? Mm-hmm.
Yeah, and I think that there's certainly some strain on staff working very hard, especially we see it over the weekend where we have only on-call staff, and then on Saturday we had a number of cases there in Winnipeg. So it's certainly a challenging time, but right now we're still reaching our contact tracing capacity that we're shooting for right now.
Can you speak in generalities about the situations that people in Winnipeg are taking part in with larger groups? Is it home gatherings, church, restaurants? Because we're seeing kind of an array of things.
Yeah, and that's actually what it is. It's not as clear as in the Paramount Health region where we did see that. It was largely gatherings, family gatherings, and many public gatherings. We're seeing, exposures at, various bars, some restaurants, just in gatherings in homes. And so there isn't really a specific scenario in Winnipeg.
We have one that we've released more details on. It's the person had 50 contacts. Can you give us a bit of details as to that extent?
Yeah, this is, I don't have details, or I wouldn't share necessarily specifics, but there are circumstances where people are symptomatic and being out and about and not getting tested for days and days after symptoms start. And so then we start seeing contacts accumulating.
Dr. Roussin, you've been talking about the fundamentals for a long time now, yet we're still seeing those close contact numbers increasing, which could indicate that people are maybe, losing touch with that, they're getting fatigue of it. What's your reaction to that when you see that?
Yeah, I mean, I think it's like we said from the beginning, this is challenge. So all these fundamentals, they're easy to know, but they're challenging to adhere to all the time because we've been doing this for so long. But if we look at, say, Prairie Mountain Health, we can see, the effectiveness of those actions. And so we're seeing cases increasing now in Winnipeg, which we're watching very closely. But if we can get back to those fundamentals, we can live with this virus without needing to repeatedly institute restrictions.
How many COVID cases are now connected to the John Pritchard School outbreak?
We're still compiling the total with it. We did have additional ones from that cohort over the weekend, but I don't have the exact numbers on it. But we did see more cases come up but only from that cohort that was self-isolating.
So are we looking at dozens now?
Well, we're going to hopefully have those numbers compiled for tomorrow. So it's certainly, we certainly saw some more cases, but within that cohort, so it's not changing our management for that school.
Are any cases from other schools or daycares connected to John Pritchard?
Not that I'm aware of, no.
What about clusters of cases from the restaurants and lounges over the weekend? Have you seen any clusters or any more than just what was reported?
Yeah, I don't think from any of our previously reported clusters, we don't have any additional to add today to that.
And the hookah lounge where there was exposure, why not close the hookah lounges? People are asking, what is it gonna take for you to shut them down?
Well, we're looking at different options with that. It certainly is not allowed under the orders, and some enforcement has been levied, and so further enforcement is always on the table. We'll be looking at it.
And if public health knew that the medical staff would be going back to their regular jobs once the surgeries that were postponed by the pandemic were going to be going back to work, and there would be fewer people available to conduct the tests, why not prepare for that? Was there any plan made for when all these medical staff would be going back to work and the testing sites would have fewer people? Like, what was the thinking, knowing that the fall was going to be a time of real concern and more tests would be required?
Yeah, actually, we spent a great deal of the summer with our plans for respiratory virus season. And so I think we hit this second wave sooner than what we were anticipating. But we certainly had things in the works for ramping up testing and all of our approach to it come fall.
For the 2 new deaths that were announced today, were they in ICU or in hospital?
They were, I believe, in hospital. One is related to the Southern Health case is related to communal living. And then the Prairie Mountain Health case was related to the Assiniboine Center outbreak that's connected to Brandon Regional Health Center.
So to make that clear, one of the 2 deaths, the communal living and the Brandon one was the same one? Sorry, I just missed that.
No, different, yeah. The one was the Southern Health is related to a communal living situation, and then the Prairie Mountain Health one was related to the Assiniboine Center, that outbreak.
Just getting back to John Pritchard for a sec, we asked you on Thursday about the investigation. Do you know what the index case was yet?
We have a better understanding now of that outbreak, and what led to the spread.
What can you tell us about it?
Not not a whole bunch that we would disclose. Certainly all the contacts and cases are aware of the importance of what they need to do now. But as far as public disclosure, we can say that we have a fairly good understanding of the makeup of that outbreak.
And in Alberta, they basically, as soon as there's a case in the school, they shut the whole school down. Are you considering doing something like that?
Well, when we were making our plans, we made our plans to avoid just that. And that's why we had these cohorts developed, so that we wouldn't need to shut down an entire school. And so if you look at most of the cases that we have so far, and granted, it's still in the incubation period, but we haven't seen a lot of transmission within schools. We have with the John Pritchard School, but again, it's within that cohort, not outside of it.
On Friday, the CDC issued more information about droplets, and that airborne particles can remain suspended in the air and travel distances beyond 6 feet, and indoor environments without good ventilation increase the risk, and that air purifiers should be used to help reduce airborne germs in indoor spaces. Is there anything that public health here is considering for indoor spaces, any kind of air purifier mandate?
Well, not necessarily a mandate. We have said that enclosed, crowded spaces are not good for transmission of this virus. That ventilation is certainly a good add-on to this. We know that when we're talking about droplet transmission or airborne transmission, it's not just completely black or white. There is a continuum, a gradient there, so that this virus is spread predominantly by close prolonged contact through droplets, through symptomatic people. We know that there are some asymptomatic transmission that goes on. We know that there may be a very small proportion that have airborne particles, possibly. But what we know is that despite all of this, 14% of close contacts develop COVID-19. So a secondary attack rate of 14% doesn't suggest a strong airborne component to it.
Weirdly, CDC removed that 2 hours ago. But seriously, just sort of keep going on John Pritchard here. Do you know, there's some confusion. It was a single cohort, but there was a second letter. Is it two cohorts at John Cohort?
Well, no, so what happened there was remember that these cases are reported out usually in the morning, and there's a case and contact investigation, and so we move certainly quickly when we see cases in schools. And so in that one, you recall, we had a single case that was outside of that cohort, and we couldn't connect it at that time. So therefore, we broadened the cohorts that we wanted to self-isolate at that time. As early as the next day, we had a clear connection with that one case to the cohort. So actually, didn't need to have anyone else self-isolating other than that one cohort, but we just kept that larger group on remote learning.
Okay, and so to be clear then, it's still a single cohort that's effective, but you kept the other out of an abundance of caution.
Right, yeah.
Okay.
So it's just two cohorts that are, or three?
It was, it's the one cohort that's required to self-isolate. The ones that are remote learning was a number of grades, right, 6 to 8, and then that 4-5 split.
And when are those new testing sites in Winnipeg opening?
I don't have a specific date on any new openings of sites, but definitely we're working on being able to increase that capacity.
And why is the province advertising for volunteers for WRHA to help out with COVID?
I don't know the specifics of what the volunteers. I know that we have our COVID call center where we do active daily monitoring. So all cases and contacts are contacted every day by public health. And for most of that can be done by people with not healthcare backgrounds. And it's just overseen by public health. So that may be one area.
So health officials in other regions are releasing examples to demonstrate how people are transmitting COVID. And they say it gives people a better idea of how their actions actually have consequences. And in Quebec, obviously, there was a lot last week. Can you give us some details on what you were seeing? Are we having unmasked dinner parties here, or those kind of gatherings?
Yeah, I think with a number of these exposures, I try to get at that. That might be something. I don't have any specific details on that I brought with me like that, but it's something that's probably a good example to show. So we may be able to bring something back.
Is 50 in a contact tracing group, is that the largest you've seen thus far?
That's, I think, about the largest we'd seen. We have our group sizes are, up to 50 maximum. And so remember that it's not always just a point source contact. It could be contacts that are accumulated over days. But yeah, I don't recall seeing, contact lists greater than 50.
All right, Doctor, we'll go to the phone for a few questions. Up first from CHVN, Taylor.
Hey, good afternoon. Can I actually get you to just explain a little bit more about what you would describe a close contact as being and how many people are ideal for that?
So a close contact is defined generally as being closer than that 2 meters for longer than 15 minutes. So that's one definition of a close contact. So people who meet that would be considered close contacts and advised to self-monitor for 14 days. And then so what's the ideal is the lower the better, right? If we start thinking about that R value, how many people does a single case come in contact with and end up transmitting that infection to? If that R value is under 1, then this virus goes away. And so this is the whole reason why we have contacts self-isolating. So if you were a contact to a case and then you self-isolate appropriately, you'll actually have zero contacts. Because you weren't in contact with anyone during your infectious period. So that's the whole reason behind the requirement for self-isolation for contacts.
Thank you. And for my follow-up, now that it's the fall, some activities for kids are starting to happen again. What should parents be looking out for when they're thinking about sending their kids to an activity?
Yeah, and I think it's making those informed decisions, that it's the enclosed spaces, crowded spaces, and prolonged contact. These are the type of things that we want to avoid. And so staying home when you're ill, ensuring frequent hand hygiene, wearing masks if you're in these indoor enclosed places, and really trying to limit the amount of contacts over time, and that's the best way to reduce our risk of this virus.
From CJOB, Will.
Good afternoon, Dr. Roussin. I'm looking right now at the pandemic response system, four-tier system that we've released. There's a litany of different response measures for each tier. I'm wondering, were Winnipeg to be moved up to the restricted orange category, what would be some of the first measures we see, or would these kind of all happen at the same time?
Yeah, well, we haven't decided on anything like that. We're constantly looking at the numbers, and then we'll try to tailor our response in the most targeted way. So I can't really answer that right now because we haven't made that decision.
Okay, understood. Thank you for that. I'm also wondering, in the last few days, we've seen Saskatchewan roll out the COVID Alert app. I'm wondering, do you see value in that app, and how soon would we here in Manitoba be able to see something like this?
Yeah, so we're still working on that. I do think there's certainly some value in that. Remember, it's not going to replace public health's ability to contact trace. That's the most important aspect of the contact tracing. This would be adding some insight to that. It's going to rely on a tremendous amount of uptake by Manitobans. We need a large proportion of the population to have that app if it's to provide really any benefit. But there certainly is some benefit with it, and we're still working on how we could apply that locally here.
From the Winnipeg Sun, Scott.
Good afternoon, Dr. Roussin. Why are masks being looked at as a restriction and not instead a proactive step that Winnipeg or even the province could have to prevent the spread of the virus?
Yeah, so they're not being looked at as a restriction because our advice right now is to wear masks in indoor public places. So and I think that there's a lot of uptake, and so it's becoming more and more normalized. There's some businesses that are requiring it. We've do have mandate in certain places like schools. So it's not viewed as necessarily restriction. It doesn't have to be tied into, say, the pandemic response system. But the messaging right now is clear: is to wear a mask indoor public places. Especially if you're not able to clearly physically distance. And we are seeing that as just yet an additional measure to those fundamentals.
Okay, and as a follow-up, I guess then why wait until indicators show a problem before addressing the actual problem? You've talked about the concern in Winnipeg and that, but again, I'm just wondering why not be proactive with the mask use with the mask mandate, instead of just waiting till all these indicators suggest it.
Yeah, well, I think when we mandate things, then we base that on on our indicators. We're messaging strongly about masks right now, and I think that's important. But we'll mandate things, under the Public Health Act when we have indicators to support that.
From CTV, Mason.
And we're talking about normalizing masks here. You check Twitter, and most people are wondering why there isn't a mask mandate. I mean, the captain of the Winnipeg Jets is even tweeting why there isn't a mask mandate. So how much does public opinion actually weigh into the decision to have a mask mandate?
Well, I think it's certainly relevant to things we do, but like I've said, is if the vast majority of Manitobans want to wear a mask at indoor public places, then we don't really need a mask mandate because Manitobans, a vast majority of Manitobans want to do it. So so it's I'd encourage Manitobans now. You don't need to wait for it to be mandated. If you support masks like I do, then wear masks indoor public places. And if it's the majority of Manitobans that want that, then we should be good.
And the Daily Bulletin says Winnipeg has a concerning number of cases. So, in your own words, how do you feel about the growing trend of cases in the city?
Yeah, exactly that. It's concerning. We're looking at that trend. Again, putting it into perspective, they have about the same number of active cases right now that Brandon did when we implemented the orange level there. When you're looking at the difference between the population sizes, we have to put into some perspective there. But we know that this virus, can be transmitted. And so we want to ensure that people are following those fundamentals now. We don't want to see the numbers continue to trend up that way. So we just wanted to get our messaging out clear that we have to adhere to those fundamentals. And as we've done that before in the first wave, as we've done that in Prairie Mountain Health, we can see that those measures are effective.
From City News, Jonas.
Good afternoon, Dr. Roussin. I just want to circle back on John Pritchard School, if I can, for a moment. Apologies. Just looking for the total number of kids that have been sent home and total number of cases now associated with.
Yeah, so the total number of cases that are associated, I don't have the total because we're compiling it. I can say that we had more positive tests over the weekend in that one cohort, but I don't have a compiled total for that. I don't think I have the number in front of me on how many kids were advised to self-isolate.
And just as a follow-up, the cohorts, can we confirm, sorry, I don't know if you've announced the grades, just confirming the cohorts that were sent home.
Yeah, so the ones that were sent home included grades 6 to 8, and there was a 4-5 split, and then there was also an early learning class.
From the Brandon Sun, Kyle.
Hello, Dr. Roussin. I was wondering about Meadows School in Brandon. It was revealed late last night that there was a COVID case there, but it wasn't revealed in Sunday's update from the province. So I'm just wondering why it wasn't included in yesterday's provincial release.
I think it probably came in after the release was sent, that information, right? So, public health is getting reports throughout the day of positive cases, and then even from those reports, we can't often tell what's, where that person is or if they are exposed to anyone. It requires a public health investigation before we know, so that's why that occurred.
Mm-hmm. So it's just a matter of you didn't have time to put together a release with when they originally reported it to you.
Yeah, we may, I don't know the specifics, but we may not even have known it by that time that it was a case in a school or what school, right? So we get a positive result and get many positive results, and each of them has to be followed up by a public health nurse to start compiling the information, where they were, do they go to school, were they self-isolating, those type of things.
Thank you, Doctor. We now return to the press conference theater.
Dr. Roussin, were many of the cases reported over the weekend connected to the exposures at the restaurants and lounges?
No, I don't think there's anything specific on that I can comment on. I know a number of the Winnipeg cases, the contact and investigation is still ongoing.
Dr. Roussin, can you provide an update because we added an update for the care home outbreaks. I know Bethesda was up to 14. We have another death from Assiniboine at Brandon Hospital. Do we have any other increases on any of the care home?
Yeah, not as of today. I don't think there's been any more increases on that, and we're gonna roll up those numbers tomorrow again. But as of today, I have not been informed of any increases.
Not a news or just a release tomorrow.
Right.
Okay, and about 15 minutes before this news conference started, a story moved out of, 7 minutes into it, a story moved out of BC. They've cut runny nose, sore throat, headache, fatigue from the symptoms list on their COVID checklist. Are we looking at doing something like that?
Well, we've reviewed our symptom list, especially our screening criteria. So it's all about, how sensitive do you want to be, right? Like, so if you have a very sensitive screening tool, it means many people will be excluded who don't have COVID. If you decrease that sensitivity, then you increase the chances of somebody with COVID passing the screening test. So we know that the runny nose alone is about 10% of our cases in Manitoba had only that one symptom. And so, again, it's not a large proportion, but we know coming into respiratory virus season, there's lots and lots of people who will have just a runny nose. And if we exclude them all, that causes lots of issues as well. So we are reviewing it, but we got to base it on our local epi and also just base it on absenteeism. If we have all those screening methods in and we're not seeing really high levels of absenteeism, then we don't necessarily have to remove it.
And if the Premier was in town today, would we have more restrictions for Winnipeg Health Region?
No, I think that we're still monitoring that situation. That's not relevant to to decision today.
Wouldn't be relevant to your decision, but it might be relevant to how some members of caucus, cabinet might.
Yeah, I can't really speak to that. Like public health has been providing advice to cabinet, to the Premier, and we've been working collaboratively throughout this pandemic.
I'm not suggesting that you listen to them, but you have said, and the Premier has said, and the Health Minister have said that you folks work in collaboration. So I was just wondering if his absence, if this would be the kind of thing that you would wait for him to be here so he can maybe take part in it, or? Not
from a public health perspective. If I wanted to make a recommendation, I would do it when the evidence required it.
Thank you.
And he's been in a city with high COVID rates. Do you think that he should be self-isolating when he gets back, or should he use his exemption and carry on?
Yeah, so certainly the elected officials aren't required to self-isolate, but I can provide advice to the Premier upon his return on those things.
Dr. Roussin, just to clarify, do you have a percentage or a number for what community transmission is in Winnipeg?
Yeah, so we're still like the absolute number that we have is 19 cases over the last 7 days. And so again, that's around that 25%. And some days it varies, so we've had days where, over a third of cases are community-based transmission, and then it comes back. So it's about that 25% right now.
The number of active cases in Winnipeg, from my count, have almost tripled since the start of September. I know you compared it to Brandon recently, which has a much smaller population. But what are you looking for in Winnipeg if, the numbers increase at this rate day over day to bring in new restrictions or limit gathering sizes?
Yeah, and so it's those, right back to those number of indicators that we always follow. So absolute case numbers are certainly important because that will tell us about the demands on public health. It will likely tell us about the demands on the healthcare system, which is another thing that we're following closely. Test positivity rate is another important measure, and then just that proportion of non-epilink cases. So we're following a number of them, and certainly the trend is in the wrong direction for us right now.
All right, I think we're done. Thank you.
Thanks very much. I have one more.